what are the risks of having non-related surgeries when you have PAH?
Fantastic. Now for me, this is starting to really talk more about how we live with pulmonary arterial hypertension. And I think this is so important because when we get beyond just how do we treat this disease, what medicines do we need, how do we follow it up, we start looking at all the other aspects of what our life brings us. And I would say that frequently, and actually very like more recently for me as a provider in PAH, my patients thankfully are doing well, but sometimes when they're doing well, they say, I can't exercise more because my knee hurts and I need a knee replacement. Or, I have a hernia and I want to see if I can have that repaired. So I think there are a number of different surgical procedures that, because we do well and people are doing better with their PAH, then we have to start to consider, is somebody able to undergo a surgical procedure that would not put them at too much risk, that it could be more of a risk to their health than the benefit that they would get from the surgery. So some of the risks of surgery are that when we go to a surgeon, often surgeons like for somebody to be get pretty significant anesthesia. And we advise against doing anesthesias that are called general anesthesia, meaning that you're essentially put completely to sleep. You may be, taken care of on a breathing machine while a surgery is being done. The reason for this is that the heart has to undergo quite a bit of strain for surgical procedures when being put on a breathing machine or when needing, some of the higher level anesthesia. And for patients with PAH, that could be very detrimental, especially if their heart is not in a position to sort of take extra strain and stress on it. So we often advise against surgical procedures unless we've had an opportunity to talk to the surgeons, talk to the anesthesiologist, create a care plan for our patient. And there are some procedures that we would just say, because this is an elective procedure, we feel that your risk of a bad outcome is too great, and we would advise against it. Every person is going to be individual in terms of whether they could do surgery or not. And sometimes it's the type of surgery or how long the surgery may take that would play into the risk for that patient.